We're here to recognize and celebrate two distinguished personalities, Dr. Muhammad Suleiman Al-Jazar, Dr. Samuel Lantel Mills. The duo have not only worked and served in their distinguished roles at the two renowned institutions, but they used the opportunity to support the Gambia, to showcase itself as the smiling coast of West Africa by investing in the welfare and well-being of our nation. The distinguished personalities we are here to honor today. Dr. Mohammed Suleiman Al-Jassar is the chair of the Islamic Development Bank Group. And Dr. Samuel Lantel Mills is the outgoing World Bank team leader for the Gambia.
Very much, Madam Chair, for that introductory remarks. Good morning, Your Excellency, the President of the Republic, Mr. Adam Barrow. Good morning, ladies and gentlemen present this morning. I have the honor to read the citations to be awarded to the insignia of Grand Commander of Order of the Republic of the Gambia, GCRG Honorary, to His Excellency Dr. Mohammed Suleiman Al-Jazar. In July 2021, the Board of Governors of the Islamic Development Bank Group elected Dr. Mohammed Suleiman Al-Zaza to lead the AAA-rated institution for 5 years. He assumed the office as President and Chairman of the Islamic Development Bank Group on the 9th of August 2021. He served as the Minister for Economy and Planning, as well as the Governor and Board Chair of the Saudi Arabian Monetary Agency, now the Saudi Central Bank, SAMA. He also served as an advisor at the Saudi Council of Ministers, General Secretariat, and the chairman of the General Authority for Competition. He was a member of several Saudi ministerial councils, boards, committees, including the Council for Economic Affairs, Development, the Supreme Council for Civil Defense, the Board of Directors of Saudi Food and Drug Authority, the Board of Directors of the Public Investment Fund, the Higher Committee for Hajj Pilgrimage Affairs, and the Ministerial Environmental Committee. Dr. Al-Zaza was the alternate governor for Saudi Arabia at the IMF, the World Bank, and the Islamic Development Bank Group. Other previous positions held included Deputy Minister for Finance and National Economy, Vice Governor and Vice Chairman of the Board of SAMA, IMF Executive Director, Chairman of the GCC Monetary Council, members of the governing body of the BASE or the Basel Committee on Banking Supervision, Chairman of the Board and Chairman of the Executive Committee of the Saudi Telecom Company, STC, Chairman of the Board of the Arab Investment Company, Chairman of the Council of Islamic Financial Services Board. Since January 2022, Dr. Saad has been a member of the Board of Directors of the Regional Center for Quality and Excellent Education in UNESCO. He also holds a PhD in economics and master's degree in economics from the University of California and a bachelor's degree in economics with honors from San Diego State University. Dr. Al-Zara received several medals and awards, most notably the King Abdul Aziz Medal of the First Order in 2001 and Senegal's most prestigious National Order of the Lion in January 2023. Under his leadership, the Islamic Development Bank has initiated the following interventions in the Gambia: development of the University of the Gambia, widening of the Barton-Hardin Highway, enhancing value addition in the groundnut sector, small ruminants production enhancement project, regional rice value chain rice development project, Gambia regional soil mapping project, strengthening rural community adaptation, solar energy project, increase of rice production project, bilingual education support project, 20 megawatts Brikama power project, Kotu Ring rural water supply system, Buyam Hospital project, reconstruction of Serekunda Mandinaba project, construction of the Sukuta Jambanjeli Road. This signia is thus being conferred on Dr. Al-Zaza in recognition of his immense contribution towards the socio-economic development of this country. Congratulations.
I now invite His Excellency to do the award.
I am Barrow, President of the Republic of the Gambia, the Grand Master of the National Board. Hereby confer on Dr. Mohammed Suleiman Al-Zaga, the insigne Grand Commander of the Republic of the Gambia, GCR 300.
Thank you very much, DVPR. Once again, Your Excellency, with your permission, I have the honor to read the citation to be awarded the insignia of Commander of the Order of the Republic of the Gambia, GCR, Honorary to Dr. Samuel Latten Mills. Dr. Samuel Latten Mills is a medical doctor, born and raised in Ghana, but now lives in Washington. He obtained his Doctor of Public Health degree in record of 2.5 years from the prestigious Johns Hopkins School of Public Health in Maryland, United States of America. Upon graduation in 2004, he started working at the World Bank office in Washington, D.C., initially as the reproductive health specialist. For over a decade, he was the global lead on results monitoring in the health, nutrition, and population global practice, providing technical assistance to operational task teams, and organizing quality enhancement reviews of projects across regions. In 2014, he led a multi-sectoral, multi-agency, and multi-country group to develop the 10-year global civil registration and vital statistics scaling up investment plan released in May 2024, which helped to galvanize global efforts to address the efficient civil registration and national identification system in 110 low and middle income countries. He's a top global CRVS expert and was previous chair of the Interagency Global CVRS group. He also led several international experts to develop the first ever 21st century state-of-the-art comprehensive CRVS e-learning course, which was launched in May 23, 2017 at a high-level event in Seoul, Republic of Korea. The course is available in English, French, and Spanish, and has been taken by about 7,000 people from 137 countries. For 2 decades, Dr. Mills has worked at the World Bank. The Gambia was the only country that out of his own volition he decided to move to support the health sector from January 2020 to January 2024. He was instrumental in the World Bank investment of 115 million in the health sector over the past 4 years, plus additional finances of 35 million, which is being prepared for approval. He also helped to inject 25 million into the Gambia, part of the multi-sectoral Sub-Saharan African Women Development, Sub-Saharan Africa Women's Empowerment and Demographic Bank Board in 2023. The Gambia project became effective in 2023 and was the only country as of March 2024 that had met project effectiveness conditions and commenced implementation. Additionally, The health sector won a World Bank and Regional Vice President Award and was adjured the transmissional project. With his multiple expertise, some of the notable achievements during his stint in the Gambia include establishment of the state-of-the-art, environmentally friendly healthcare waste management system, setting up a national food and drug quality control laboratory, which is currently being constructed in Brusubi, construction and equipment of equipping of Farato National Emergency Treatment Center, intensive care unit, emergency observation treatment center, national public health laboratory training center, national blood transfusion center, conference center, national diagnostic imaging center. When this project is completed by 2024, it will contribute to the preparedness and response to future pandemics. Asbestos removal was undertaken in 2023, and renovation is ongoing over a dozen health facilities across the country containing asbestos. Construction of a national intensive care unit, which is ongoing on Edward Francis Small Teaching Hospital. Renovation of Ndemban Clinic. Renovation of X-ray rooms in 5 hospitals, which include Bansang Hospital, Buyam General Hospital, Edward Francis Small Teaching Hospital, Frafenye Hospital, Kanifin Hospital. All has been completed for the installation of new X-ray machines. The postgraduate medical training program has been revamped. The project supported the recruitment of 30 international consultants who are providing specialist service and training local Gambian doctors to become specialists. Currently, there are 99 trainees enrolled in the program, and several departments have received accreditation from West Africa, College of Physicians and Surgeons. Postgraduate nursing training program has also been established. The first intake of students for the 3-year Bachelor's of Science, that is BSc Nurse program, and the BSc in Midwifery program was in January 2021. The project was also supported the establishment of 18-month postgraduate diploma program in nursing, midwifery, pediatric nursing, and then perioperatic nursing. The project is also supporting the undergraduate and dental program and postgraduate oral and multifocal surgery training program. The health sector is leading the government drives in digitalization, and electronic civil registration and vital statistics has been established. Previous civil registration was paper-based until 2022, when the project supported development of the functional ECVR CVS system, and the Ministry of Health undertook an innovative approach of conducting a mass registration where both the birth certificate and health insurance card with the national identification number, NIN, and the QR code were issued at the same time. Half of the population of all ages have been registered. Other systems that issued at the same time. Project was supported also electronic human resource management, information system, electronic national insurance system, electronic health record system, electronic assets management information system, electronic logistic management information system, and electronic case-based surveillance system. Under Dr. Mills' leadership, the project has supported the establishment of the national insurance authorities to oversee the implementation of performance-based national health insurance scheme for the residents of the Gambia. Dr. Mills' love for the Gambia has been in integration into the Gambian society and has become indistinguishable and at social events and celebrations. In conclusion, Dr. Mills' dedication and commitment is exemplary in assisting the government of the Gambia to improve access to quality healthcare service, as well as strengthening the national system for public health preparedness. This insignia is thus being conferred on him in recognition of his outstanding and selfless service to the Gambia. Congratulations.
I, Adam Barrow, President of the Republic of the Gambia. confer on Dr. Samuel Lantin Mills the insignia of the Grand Commander of the Order of the Republic of the Gambia, G.R.G. Honor.
I will now invite the Honorable Minister for Finance and Economic Affairs, Honorable.
My statement here today is just going to be an icing on the cake, following your acceptance and confirmation to give honor to His Excellency President Mohammed Suleiman Al Jasir of the Islamic Development Bank Group. Your Excellency Mohammed Al Jasir's contribution and personal engagement in the Gambia has been notable, and he led the Islamic Development Bank Group, which has been an institutional and multilateral pioneer partner in development of this country. The intervention of the Islamic Development Bank Group in the Gambia has been very beneficial to the national development over the last 44 years since our engagement with the bank commenced. And the relationship has been one of true partnership in development. And Mohammed Jasir, under his leadership, has continued that relationship. And they have been consistent, reliable throughout the engagement period. I will hasten to mention, Your Excellency, that the Islamic Development Bank is the one partner institution that has never ever ceased operation in this country from the commencement of our engagement. Their contribution in the economy is far-reaching. They have helped participate in different sectors of the economy, from the water, electricity, the University of the Gambia, Batin Harding Highway, and over the period, the financing extended, reached more than 1.5 billion over the 44-year period. So it is in this recognition that Your Excellency has accepted, and we could not in any way demonstrate our symbol of appreciation than to confer on you, Your Excellency Mohammed Al Jasir, this distinguished award by His Excellency the President of the Republic. I thank you all for your kind attention.
I now call on the Minister for Health, Honorable Dr. Samate.
We are very delighted to stand in front of you this morning to be part of this process. We say Alhamdulillah Rabbil Alameen. We thank the Almighty Allah for making this possible, because this is a unique occasion. We start by thanking His Excellency, the President of the Republic of the Gambia, for recognizing these two gentlemen here. It is a show of His Excellency's commitment to the socio-economic development of this country, ensuring that the social sectors are taken care of. Education and health certainly are very important. Awarding Dr. Samuel Mills today is a manifestation of His Excellency's commitment to the health of the people of this country. Since his government came into office 7 years ago, it has not been an easy ride. We inherited very difficult circumstances in the health sector, dilapidated health infrastructure, obsolete or absent equipment, low human capacity, supply chain challenges, and so on and so forth. And his commitment from the onset was to revamp the health sector of this country with the notion that there cannot be any meaningful development if the people of this country are not healthy. Agriculture certainly will not thrive if people are not healthy. People cannot go to school when they are not healthy. Security cannot be maintained if the security officials are not healthy. For that reason, investing in the health sector has been very, very high on his agenda. And we were given the task. And the task was to ensure that access has been increased. Access meaning improving on the current health infrastructure, and we are currently doing that, ensuring that the current dilapidated facilities are expanded, renovated, and upgraded to build new health facilities so that where the people do not have access to health facilities, they are able to go within very short distances to have access to these health facilities. But of course, building the structures, there has to be the equipment. So ensuring that there is procurement of equipment, life-saving equipment in these facilities. That's the second point. But with the equipment and the facilities, we need the competent people who are going to provide those services. Otherwise, there will be white elephants. And that's why he put emphasis on capacity building for the health sector. Now you can see where everything falls in place in the citation of Dr. Samuel Mills. These have been the targets. So whatever we've been able to do with the World Bank, it is based on the fact that it is the vision of His Excellency that we are implementing. That is infrastructure development with the construction of the teaching hospital in Farad, the emergency center, which is a state-of-the-art facility, the clinical waste management system, the other health infrastructure we are building, the laboratory, the quality control, food and drug quality control lab, and so on and so forth. And these are all geared towards providing high quality services. They go with equipment, world-class equipment that the Gambia is getting. Now, of course, as I said earlier, without that, without the trained people, this equipment will not be useful. Now we participate in the postgraduate training program. All these have been made because of the sacrifice, the hard work, the commitment, the dedication of Dr. Samuel Lanter Mills. That is why he's been awarded here today. Dr. Mills has been part and parcel of the planning processes in all these areas, and he endeavored, he persevered to ensure that implementation is carried out in a timely fashion. We had quarrels sometimes where we've all been under pressure on either side. We put pressure on him and he put pressure on our team. But at the end of the day, we are getting the results that we are talking about today. And that is why we are very proud, Your Excellency, that Dr. Samuel Mills is getting this award today. Of course, Dr. Samuel Mills worked under Dr. Faye Borofis, who was providing the funds for this to be possible. So we equally thank her and the entire World Bank team. Of course, the Minister of Finance, I call him back and forth. Occasionally, we have push and pull and quarrel, but for the good of the country, because we want most of the resources to come to the health sector. And he says to us, it cannot be the health sector alone. Your Excellency, awarding Dr. Samuel Mills is an award for all of us in the health sector and all the friends of the bank and the entire Ministry of Health, because it's recognizing the important impact his work, the work of World Bank in collaboration of the Ministry of Health is having in the health sector. I thank you once again for your kind attention, and I thank His Excellency for being this generous, but we are very optimistic. The two awardees here, we want to say the style of governance of His Excellency is commitment to improvement the living standard of the people of this country. Within 7 years, all these have been, we're able to do this. Inshallah, with your continuous support, which we certainly encourage you to, with your continuous support, in the next few years, Gambia will be one of the best countries in the region. I thank you very much.
Bismillah ar-Rahman ar-Rahim. Your Excellency, the President of the Republic of the Gambia, the ministers and distinguished guests, I am humbled and honored by this award that Your Excellency is bestowing upon me as the representative of the Islamic Development Bank. We have been collaborating and working as one team with the people of the Gambia since 1980, and we are very proud of the achievements that have been made during that period. My friend Minister Sidi Kita had mentioned that since 1980, the engagement has been about $1.5 billion with the Gambia in a variety of projects that are all in the benefit of the citizens of the country, to facilitate their lives, to enable their kids to go to school, to bring light to their homes, and to bring technology and seeds to their farms. All of this is of critical importance, and Your Excellency had the vision to see it early on and to keep pushing us as bankers, development bankers, not commercial bankers, and your team also to ensure that the projects are completed on time and the services are rendered to those who have been waiting so long for that. So thank you very much, Mr. President, for the partnership. Thank you very much for your dedication and nudging and pushing to ensure that the projects are implemented in time and within budget. We have a lot of challenges, as was mentioned earlier, but development by definition is an agonizing process. So let's have no mistake about it. It's not going to be any easier in going forward, but our determination will be there together, and the commitment of the Islamic Development Bank, Mr. President, is unwavering. I can assure you we will always be there to help. And we are proud, actually, of the achievements that have been made by the Gambia. We want the Gambia to be an example of a member country that comes and asks for financing, but makes sure that that financing is put into good use and that the services are delivered. So thank you very much for your confidence, and thank you very much for your partnership, and we will always be there with our brothers and sisters of the Gambia with your leadership, inshallah. Wassalamu alaikum wa rahmatullahi wa barakatuh.
His Excellency Dr. Mohammed Suleiman Al Jazer, Chairman of the Islamic Development Bank Group, dignitaries present, distinguished ladies and gentlemen. On behalf of the World Bank Group, I take this singular opportunity to express our heartfelt thanks to Your Excellency Mr. Adama Barrow, the President of the Republic of the Gambia, for this honor, national honor that you have bestowed on the World Bank Group as well as the Islamic Development Bank Group. The World Bank appreciates the opportunity to be a partner in the development of this country. In 1999, the World Bank approved a project for the Ministry of Health. And since then, there has been a long hiatus in the World Bank's direct engagement with the Ministry of Health until 2020. In the last 4 years, the World Bank has been the largest financier in the health sector. More importantly, the World Bank's global technical expertise has helped to reshape the policy dialogue in the health sector. I want to congratulate Your Excellency for your strong leadership, for your vision for the health sector. The progress that you've made in this relatively short period is remarkable, and it is history in the making. I also want to congratulate Dr. Ahmad Dlamini Samate, the Minister of Health, Professor Omaja Jr., the Permanent Secretary, the management of Ministry of Health, the staff of the Ministry of Health, the Project Coordination Unit for the tremendous progress that you have made in the last few years. I recall in the early days of COVID, there was no public health laboratory that could test for COVID. There was no public health public health facility that could treat COVID cases. But today, it's a remarkably different story that we see on the ground. In a couple of months, the construction of the National Emergency Treatment Center, plus the National Public Health Laboratory will be completed, and hopefully it will be inaugurated in a couple of months. Or additionally, the National Diagnostic Imaging Center would also be inaugurated around the same time. We all know that there are people in this country who have to travel outside the country to get diagnostic imaging services, MRI, CT scan, mammogram, what have you. And hopefully, when this construction is completed in a couple of months, it will become a thing of the past for people to leave the country to go abroad for such services. The postgraduate program has also been a remarkable success for the training of doctors, for the training of midwives, and also the dental program as well. Actually, a couple of weeks ago, we are pleased that the candidates that the Gambia presented for examination at the West African College of Physicians and Surgeons, they all passed their exams in Gambia. That shows the remarkable progress that you have made. Skilled nurse anesthetists, midwives with bachelor's degree and postgraduate diploma have been trained at the University of the Gambia as well. There are plans in place to train 350 more midwives who will then be posted to all the rural areas across the country. This, along with the National Blood Transfusion Center that will be inaugurated shortly, will contribute to the downward trend in the reduction of maternal mortality in this country. The health sector, Your Excellency, is leading the government's vision for digital transformation in this country. And the sector has initiated the process for interoperability with the systems in other sectors as well. As was mentioned earlier, there is now in place a healthcare waste management system across the country which is environmentally friendly, not the ones that spew gases, poisonous gases into the air. We have the chair and the CEO of the National Health Insurance Authority with us here as well. The National Health Insurance Scheme rollout began on April 1st with a focus on delivery and newborn care. We are hoping that with time, the services will actually be expanded as well. Without further ado, let me conclude by thanking Your Excellency for this honor that you have bestowed on the World Bank Group and then the Islamic Development Bank Group. The best days are yet to come. This is just a beginning of many, many good things that will happen in this country. We really thank you for all that we thank you for your leadership, and we pray for good health, for success, for you as well as all the people of this great country called the Smiling Coast. So thank you all very much for your attention. We really appreciate it.